Center.
Perfect. Thank you. Hi, everybody. I just want to take a moment to introduce myself. Like Lisa said, my name is Karyn Holtz. I'm a physical therapist and certified lymphedema therapist with Rush Physical Therapy. I also participate in the ReVital Cancer Rehab Program, which is a specialized training program offered through Rush that basically is a more specific oncology certification program. So I am also a ReVital certified therapist. So I'm just happy to be here today and happy to have the opportunity to discuss with you guys some tips about cancer related pain. So feel free, like we said before, to at any moment to just kind of jump in and go ahead and we can go through and ask some questions. So I always like to start a presentation with this slide just to remind everybody that cancer is a journey and not everybody's path is the same. Everybody's path starts at a different point, ends at a different point. Many things affect that trajectory of your path, including your age, your beliefs, your support system of family and friends, your general health and well-being, and that continues to how you start your journey. And remembering that everybody's destination is a little bit different. Everybody may have different goals and everybody may also have different treatment plans along the way. So just remember that your journey is unique to yourself. So just kind of taking that in consideration. And like we said, different choices. Some people may have surgery, chemotherapy, targeted therapy, or radiation. And that's all the stuff that's just customized specifically for you by your cancer care team. So just always a good idea just to remember that as you go through your cancer journey. So what is cancer-related pain? I think we're all here today because we may be experiencing that at some point. So it's always important to start with a definition of cancer-related pain. You may see in literature that it's abbreviated as CRP, which cancer-related pain. The International Association for the Study of Pain and National Comprehensive Cancer Network's definition is an unpleasant sensory and emotional experience associated with actual or potential tissue damage caused by cancer or cancer treatment. They may affect the quality of life and ability to function even after treatment ends. So before we move on, it's important to highlight two distinct parts of this definition. So the pain has both sensory and an emotional component associated with it, and pain can be caused by the cancer itself or the associated cancer treatment. Your body is learning how to best manage cancer and its side effects. So that's always important to kind of remember and always discuss your pain kind of with your healthcare care team as well. So this slide is just showing us a multi-dimensional nature of cancer-related pain. So as we mentioned earlier, cancer-related pain presents itself in a variety of different ways. Physical pain, that's the nature of pain itself and what it's doing to your body. The sensory component of pain is how you would describe your pain, such as either throbbing, burning, aching, and kind of where that pain is located. There's also that emotional component of pain, which can then lead to depression and anxiety that can be associated with pain in certain situations. The psychological aspect, also known as the cognitive component of pain, influences how you view yourself or the way you think. And then lastly, behavioral component of pain. This refers to how pain may impact your ability to just participate in social roles, day-to-day activity, kind of like how you participate in your overall quality of life. So ironically, let's kind of think about how our nerves work, because nerves work. So this actually sounds kind of bizarre to think of the benefits of pain, but it's also important to understand how our nerves work. So your body has over 400 nerves that are all connected like a highway system. Nerves have a small amount of electricity running through them at all times, and that's normal. How much electrical activity is happening depends on factors such as stress, movement, and temperature. Pain also travels through your nervous system. So it's important to recognize that not all pain is bad. Sometimes pain can be a good thing. nerves don't really send messages until there's enough activity to reach a certain point. So if you think of like a pot of boiling water that does not boil over until it reaches a certain temperature, that's kind of that's a kind of a good analogy here. And when it reaches that point, it sends a message to the brain, like to check things out. So you like check the water as it's boiling over the pot. So you think of stepping also on a rusty nail. If you step on a nail, signals are sent to your brain to let you know that there is damage. Once the pain signals reach that specific point, an alarm kind of goes off in your body. The brain hears that alarm and knows to do something. This alarm alerts the brain. If your brain perceives danger, it will produce pain to alert you. So for example, if we think back to that rusty nail, to be pulled out, pain is produced by your brain when it believes you need protection. Remember, you can have tissue injury and pain. There are two different things. You can have pain, but no tissue injury, and you could have tissue injury, but no pain. So let's think as we're going through and thinking of cancer and cancer-related pain, let's think of those things that are pain influencers. So different aspects of your cancer journey can absolutely influence why you experience pain. It can be due to cancer itself, such as a tumor pressing in a certain area on either a muscle or nerves, or it could also be bone pain related to like metastatic disease. Chemotherapy can also be something that causes pain, which is called chemotherapy-induced peripheral neuropathy, or CIPN for short. Which causes that numbness and tingling sensation in your hands and feet. And that's related mostly to those cancers that are treated with your neurotoxic agents. Healing after surgery can also be an influence of pain because your body is still in a state of inflammation that is still present during your recovery. And then also radiation. So radiation could cause pain for a multitude of reasons, basically. Like if you could have pain due to radiation from lying in the same position. So in the instance of like a breast cancer patient, you're having your arm held in an overhead position. So that can cause some pain, especially to a shoulder that may have some decreased range of motion. But you can also experience the skin sensations after radiation, which can also trigger some pain. Thinking back, going through biopsies can also cause pain or any other testing. A combination of cancer treatments or other pain influencers can also be present and vary from person to person. So I guess probably everybody's biggest question is, if you do have pain, when do you reach out to your doctor? And that's always like the biggest thing, because as you're going through, you can be experiencing so many different things as you're going through cancer treatment. So if you have experienced pain that does not change with different body positions, if you begin to lose sensation in your legs, anything that is pain that just persists beyond what you appear as normal, or you can't correlate to an activity, that's when you want to reach out to your oncologist and let them know what's going on. Because again, there are things that we can do to help with that cancer-related pain. So if we dive a little bit more specific into each category, let's start with surgery. So pain may be felt after the removal of the tumor that can be present for days or even a few weeks after surgery. If you think of that pain, as you go through that recovery process, this pain will generally like decrease in sensation, and then it should eventually resolve itself. Like mentioned earlier, moving on to chemotherapy, some of those chemotherapy agents, especially those that are considered more neurotoxic, can cause peripheral neuropathy. And that you can experience the burning, numbing, tingling in your hands, arms, legs, and feet. And usually what we like to remind people is that type of pain occurs in a stocking and glove pattern. So you're going to have it in both hands, both feet. And it usually presents itself, like we said, in a glove pattern or in a stocking pattern. So just kind of keeping that in mind, remember that that type of pain is typically seen in both hands, not just your right or not just your left. So that's always kind of important to take note of when you're talking about peripheral neuropathy. But you might start to notice that type of symptoms with difficulty in opening jars. You might start to feel like you're losing your balance a little bit, or having trouble walking. So again, that's still considered a pain because it's that like neural type of pain. When we look at radiation, like we said before, it might be from positioning, but it can also be pain related to those different effects on the skin. So it can cause hardening of the layers of the skin on or under the skin. So when we think of that, we like to think of a kitchen sponge. When you open a sponge out of the packet, the sponge is super flexible. And over that time, that sponge hardens and loses its sponginess and pliability. So that is probably the best analogy when you start to think of like those fibrotic changes that can happen to your skin. And again, as those tissues tighten, that can also cause some pain. It's forcing your body into potentially a different posture that can put pressures on different joints and nerves. So again, just kind of seeing if you notice any pain that correlates directly to radiation as well. And lastly, I think we talked about this a little bit as well about your like diagnostic testing. So again, a biopsy or anything like that, bone marrow or biopsies can cause pain similar to a surgery. And eventually you would like to see that pain resolves itself over time. So what we look at is how do you deal with that pain? And this is where kind of looking at like a cancer rehab program and understanding what cancer rehab can do for you is a good way and a good avenue to treat that cancer related pain. So if you're noticing that your pain signals have become more sensitive, you may need to consider cancer rehab. Let's say you recently had surgery to remove a tumor and experiencing post-surgical pain, or you went under radiation. You may have limited range of motion. You may have limited ability to perform ADLs, like pulling on pants, putting on a shirt. And that's all the things that we look at in like a physical therapy evaluation. We go ahead and evaluate like the effects of those cancer treatments and try to narrow down what is the root of the cause of that pain. So if we look at the mountain of pain, we'll call this the mountain of pain, and it's used to show how pain sensitivity can vary between people. Once action is taken, the alarm system should calm down to the original resting level. So we talk about like that post-surgical pain that's bringing you down to your original resting level. That original resting level, however, varies from person to person from the start. In some people, nerves wake up easier or calm down slower. In others, nerves can stay elevated and buzzing all the time or stay elevated once the alarm goes off. It takes a lot less activity for these nerves to then send messages. And once a nerve is sensitive, or if you think of it as like hypersensitive, it may make it easier to send that pain message. Often before pain, you could do normal tasks easily and for a long period of time. But now as a patient, you notice that you're only able to do that for shorter periods of time. So if we think about that, like let's kind of talk through like a patient situation. So I've had a patient, we'll use an example of a patient with like peripheral neuropathy, and they have pain in their hands and their feet from that neurotoxic chemotherapy. A lot of times you come to therapy and you just feel like nothing's making it better. And we understand that there is, as we talked about earlier, that psychological effect where then it becomes depressed because you're not able to do the same things you are able to do. So you can't take care of your household. You're not as able to be as social with your family because you can't stand and walk as much as you used to be able to do. Well, what's happened is the nerves have become more sensitive so that something as simple as walking can cause pain. When prior to having undergone any cancer treatment, that would seem like a task that was nothing. So what we do in those situations, like in that patient example, what we do is we kind of work towards desensitizing some of those nerve signals in that peripheral neuropathy patient through different manual techniques and some stretching. And then we always look at things like balance and function, understanding that overall we want to improve that quality of life and decrease any other risks that could be related to a fall. So like I said before, what we're looking at is then how do we assess what pain is normal for you, or what we're going to do to treat that pain. So as physical therapists, we start out taking a thorough medical history. It's very, very important that we understand what your prior level of function was and what your goals are. So again, kind of alluding to that previous slide, we want to remember that not everybody's journey is the same. Not everybody's prior level of function is the same. So we're kind of looking at that to understand what each person's goals are and where they want to get to. So for example, if somebody underwent a mastectomy, they might be experiencing some of that post-operative surgical pain. But because of that pain, that person may have like a limited use of their upper extremity. So what we would do is measure that range of motion, compare it side to side. Definitely get somebody going with an exercise program. Exercise is always very, very important throughout that cancer continuum, recognizing that there are research studies suggesting that exercise has substantial benefits throughout the cancer continuum. And so just looking at those type of things, and then addressing any weakness, et cetera, that somebody might be having. And then really listening to the person to understand what that person does need in order to regain their goals. So here's kind of the big thing is to talk through exercise. So this is where, like, a lot of times, even going through programs throughout the center or seeking out a therapist or any other like structured exercise groups are always beneficial. Because sometimes it's that big question of when is pain okay? So understanding what pain is okay to push through is sometimes difficult when you're going through the cancer care, because you're concerned whether something is good to push through, not good to push through. So that's where we assess for any specific injuries. And we're well equipped to look for those side effects that you might be having. Even working through like exercise is hugely important. And I know that's not our topic today, but it's super important for even working through that cancer-related fatigue, and definitely even working through some of that weakness. So what we look at is setting up a multi-component exercise program for individuals to restore muscle imbalances, restore posture. So anytime you've had any type of cancer-related surgeries or treatment, a lot of times posture can be significantly affected. As you have pain, we're all pretty smart. We tend to guard and get into positions and postures to protect tissues that are sore. So in the case of a patient who's post-mastectomy or even undergoing lung cancer treatment, you want to kind of come into that more forward-shouldered, forward-flexed posture. Which overall affects your whole body. So it sends a muscle imbalance throughout that upper back, throughout the chest wall. And it can even, ironically, as you go into more forward flexed, you could even get tightness that people don't think of in your hip flexors or the muscles across your hip, just from throwing yourself into a more forward flexed posture. So it's always good to have kind of that thorough assessment and then see if you can correlate like where or why you're getting your pain. Is always good. And then restoring strength to restore that good muscle balance is kind of our ultimate goal, is to get you a strengthening portion. And then to end, we always want you to get to that self-management where you have enough tools in the toolbox where you feel like you can really control all that yourself. So let's talk a little bit about that self-management piece. So listed here are ways that you can address that cancer-related pain at home. I'm not sure how many of you at this point are engaging in an exercise program, but some simple stuff. Here's some simple takeaways. Take a few minutes in the morning or before you go to bed to perform slow, deep breathing exercises. It just overall resets your system. A lot of times those deep breathing exercises are highly recommended You have a lot of your lymphatics sit in the abdominal cavity. So those deep breathing exercises are just really good ways, like we said, to reset the system, keep lymphatic flow going. I know yoga is very popular as a cancer exercise. And that does incorporate a lot of those deep breathing techniques that just helps keep lymphatic flow going. Sometimes people like to just kind of get to that happy place. So whether that means to download a meditation app that can walk you through a series of simple relaxation and just mindful techniques. Just because remember, we do have that psychological component of pain that can then lead to some depression and anxiety over that pain, especially as you've gone through cancer treatment. Create your favorite playlist, listen to music, listen to something you enjoy. Incorporate that aerobic exercise. So we talked about technically, it's recommended to have about 150 minutes of exercise throughout your course of your cancer continuum. So remember, aerobic conditioning is very important. So whether that's alone, get a buddy, get an exercise buddy, join a group, but just make sure you're kind of participating in that aerobic exercise, a gentle warm bath for relaxation. And remember, whenever you're doing these self strategies to try to control your pain, do an activity you enjoy. So just because somebody enjoys yoga doesn't mean you have to. It's a great form of exercise, but do something you like. Try something new, but do what you think you're going to be most consistent with as far as trying to control your pain, because the more you enjoy it, the more likely you are to keep consistent and keep doing it. And then lastly, kind of make sure you have that support system, whether it's coming from a family, a friend, a counselor, or any other support groups that you find within the community, because cancer-related pain is real. So you want to just make sure that you are having a good support system that can help you work through any pain you're having, just so that you make sure that you're keeping yourself as healthy as you possibly can, both physically and mentally. So kind of looking at this, we understand that having a cancer diagnosis is not a one and done type of diagnosis. So cancer treatment may last months or years, and its effects on your function, mobility, and quality of life can present even once you've entered survivorship. Because of this, you're done with therapy. You aren't quite done with thinking about the effects of cancer on your just overall self. We want to continue. So when we look at this stuff, we always want to be a resource for patients. So, looking at cancer rehab and looking at how we manage cancer-related pain is much different than a standard physical therapy type situation. I'm not sure how many of you know, like a patient who's had physical therapy before, but you have a knee replacement done and people go 3 times a week for a 12-week period, and then they're done with their rehab. Usually throughout like cancer rehab and survivorship, we like to see our patients a little bit sporadically, even once they feel like they're kind of done in the clinic. And the reason is because as you go throughout the continuum, like we said, you can have effects that can come 6 months later, a year later. Maybe you've been really diligent at your exercises and that's great. And 6 months from now, you're at a different point than you were when you last saw a physical therapist and you didn't upgrade to your program because you're doing so well. Or maybe you have a new pain that's arisen that you don't know how to manage, or maybe you've developed some neuropathy. So it's always kind of an ongoing system that we do. We call it like a surveillance program, just to make sure that patients are reaching and achieving all their goals, especially when it's related to pain. So that's where we come in to kind of monitor and guide our patients in the right direction when it's coming to like kind of deciphering whether that pain is something that needs to be alarming, or how we can manage that pain for you. And lastly, be an advocate for yourself. So I think the hardest thing is nobody wants to ever feel like they're bothering somebody. Pain can be a normal part of your cancer journey. But just remember, like, suffering pain is not normal. So we talked about some of those situations where, pain is expected to eventually resolve itself, or it should start to feel better. Advocate for yourself in the fact that you want to kind of talk to your physicians and keep those resources for yourself out there, because you want to resume to have a better quality of life. So if you're experiencing significant pain, it's going to affect your overall physical as well as your mental state. So make sure you have those resources to talk through throughout your cancer journey, so that you are able to kind of get into the right place and kind of work through some of that cancer related pain. So that's where I'm at with the end for the presentation, but we can kind of open it up. So if anybody has any significant questions, or any questions on pain, or how to identify pain, or what pain is, pain good, bad, and different, or different questions they have on exercise, I'd be happy to kind of open that up to some questions now.
We did have a couple questions as the program went on. And so here's the first one. How can we manage surgically damaged nerve pain other than taking medication?
So I would say, does the person want to pop on? Because there's I kind of have a bunch of different, so a lot of times we'll work through different things. So I can kind of give an example here, and then if somebody has more questions, they can kind of go from there. So I'll say, even within our head and neck cancer population, sometimes related to either surgery or radiation, we've had people who then end up with you've had an anterior neck surgery, but because of the nerves, you end up with a nerve issue that causes a shoulder dysfunction. So occasionally we'll see people who then don't have full strength in their shoulder, and they have limited range of motion, because if the muscles and the nerves aren't receiving that motor function, then they can't raise their arm. So in those situations, as a physical therapist, we work to make sure the person regains their range of motion. And then we'll also work to try to re-strengthen, if there's something neurological in that sense where they're losing motor function, what we do as physical therapists, we then try to work towards strengthening up all the other muscles in the area, and even trying to do exercises that then could try to get that other nerve area to kind of regenerate itself, and kind of retrain it to remember what it's supposed to do. So that would be kind of one example when somebody's looking at a motor loss of function. When we're looking at people who might be, so you could have two different signals from nerve type pain, right? So you can have a sensory function, which is going to be more of that numbness, tingling, burning, aching type of sensations, or you can also have motor involvement. So what I was describing with that head and neck patient would probably be more of a motor impact that they're having, where they're getting a little less muscle function. When you're looking at a nerve, you're getting that tingling or burning. Example I would use is a person who maybe had radiation and ended up with a lot of fibrotic tissue across that pec and chest wall. That can pull you into that forward position. And then being pulled into that forward position could put your shoulder doesn't want to be in that forward position. So it puts a lot of stress through different muscles and tissues, because they're not acting and functioning at the length that they'd want to normally function with. You might start shrugging your shoulder, you might start holding your neck differently. So what we do is we evaluate and go in and look okay, what's the person's resting posture? You look at the integrity of that fibrotic tissue. How long has it been since radiation? Can we do some stretching exercises that's, we might not get the tissues to feel as pliable as they do on the non-radiated side, but we want to get a little bit more function in that area. So if we can do some other things to work a little bit of flexibility in through that region to try to take pressures off some of those nerve roots. Is it something that you're holding your neck differently? That could be pinching off those nerve roots. So that's all this stuff we would assess. So then we're working some flexibility exercises, some range of motion. The person who's sitting in that real forward posture, we want to get you using those shoulder blade muscles. So that would be something where we'd retrain those muscles so that you could kind of posturally sit in a better. And then I guess lastly, if it's somebody with like more of that hand and glove, the glove and stocking pattern with a peripheral neuropathy, a lot of times those nerves are almost hyper stimulated. So what we would do is a lot of massaging and tactile, just retraining some of that fine grip motion, because that's a lot of times the problems with hand patients is that fine motor, like being able to button or pinch. A lot of times occupational therapists might get involved with that, as well as PTs to just kind of retrain that fine motor. And then in the case of somebody who's having more of that stocking pattern in their feet for nerve pain, I guess we would probably look more at the same, like that tactile. A lot of times that tactile takes some of that hypersensitivity away. But our biggest concerns with our neuropathy patients in the feet is going to be, what is your sensation like? What's your balance like? What's your fall risks? If you're anybody who's on hormone related therapy, how is that affecting your bone density? So somebody who has a lower bone density, you're especially cautious with their fall risk. So that's kind of probably like three of the best examples I could give with that, to just kind of put it into more relative patient position of like what we would do to address like that nerve type symptoms. So I hope that like answered your question. And if it didn't, feel free to throw more specifics in the chat.
And I do apologize. After you started talking, I realized she did write, this participant wrote, her history involved resection of 2 ribs.
Okay. So again, I would probably look at that because of, depending, my assumption would be that it was up at the first and second rib, not the lower ribs. But just having any differences of those ribs taken out obviously affects like how the muscles are attaching, and just overall posture. So to me, that would be something where we'd want to look at flexibility, trunk range of motion, and as well as like that shoulder range of motion. Anytime you've had anything surgically done, what does the scar tissue look like? So I think a lot of times like scar tissue is something that's overlooked. So, if you have a lot of like tightness within that scar, the tissues aren't going to move as well. So a lot of times we'll do a lot of scar tissue mobilization as work as well. And just some manual work in those regions. And a lot of times that can help alleviate some of that nerve pain too. So I hope that helps a little bit and answers that. But like we said too, each person is individual. So, with having 2 ribs resected, not each person is going to present the same. So that's where we kind of individualize and look at what that person's complaints is at that time.
We had another question, commenting question actually. It is always so much longer to work through pain after reoccurrences, and is it always so much longer to work through pain after reoccurrences and multiple surgeries? Does it ever last forever? I will say that my nerve pain has improved finally somewhat, so I guess there's hope.
So I think for that question, it's hard to predict, like everybody's a little bit different. So I think that as you work through, again, after you've had a surgery, after you've had treatment, to say you're going to be 100% is sometimes difficult to say, depending on what type of surgery and procedures you've had done. But I think the biggest thing is if you're starting to see improvement, then that's like the perfect example of like where seek out and talk to your doctor. Like, hey, I feel like I'm at 75%, but would you be open for me trying some cancer rehab to see if I could get that other 25% back? I think until, depending on what you've tried as far as like to manage that, if you haven't tried any exercise or any therapy, it might be worth a shot to see like how much better you can be. Even if it's like kind of a one and done exercise thing, like, hey, I just want to go to a physical therapist to see if I could get some exercises that might help me get over that hump. I just always think that's worth the benefit because you never know until you try something. So
this person always asked, does the scar tissue just keep growing? Because it seems like some nerve pain comes later as tissue maybe is growing.
So usually I wouldn't say like so when you get that initial phase of healing, you're going to have immature scar tissue lay down. So a lot of times what we'll see is like, your scar is initially going to be more bumpy. And usually what we like to do is a lot of like, once your scar is healed, we manually do a lot of like scar tissue mobilization and through there. Normally your scar tissue can lay down in a real haphazard pattern. So by doing some massaging over that area, it helps the tissues to lay down more orderly. Some people scar a little bit differently. So I have a patient now, and every other scar she has is fantastic, but she got some keloiding over where her port was removed. Sometimes it's hard. She's doing some scar mobs. She's using some of, the silicone pads. So I wouldn't necessarily say scar tissue should grow, but it might be more noticeable, just over time, just because it does stay a little bit bumpy. But I would definitely, if you have that scar, try putting a little pressure down on it, try massaging it. Sometimes by just getting it to lay down in a less haphazard pattern, that might take some of that hypersensitivity away of that like nerve pain. A lot of times I've had patients describe scars as just feeling weird because they know you're pressing on them, but yet they feel numb, but yet it's kind of still painful, which they're like is a really weird thing to try to describe. But, it's not uncommon that that's how people kind of describe those things as well.
Thank you. Next question. After left breast mastectomy and 18 lymph nodes removed from my armpit, after my first chemo appointment, I got shingles on the right lower quadrant of my body. When I get stressed out, it flares up. Why does this continue to happen?
So I think that would be, I would ask the oncology team that question, because I really don't have a great answer for that, since, obviously it's that nerve pattern distribution. But I would kind of talk more with the oncology team of why you do get those shingle flares. Because that's more of a systemic than like yes, it's in nerve patterns, but, I don't know if I necessarily have the right answer for you on that one. So I would definitely reference that back to see if the oncology team,
can I speak? I'm the one, can I speak for a moment? Just, I went to, physical therapy, and she said, how did you sit while you were doing chemo? And I said I was in a kind of a lounge position, and she believes that my neuropathy and the shingles was created because the way I was sitting for 4 hours getting chemo through my port. So it was like this, and she thought everything just went to my back because it's on my right butt cheek that I get the shingles. And I have a lot of right pain from the way I was sitting during chemo each session. So I'm not sure if that helps.
I could see where from that, but shingles is usually going to come when you're more compromised immune system. So I could see getting left buttocks pain from positioning, if that makes sense, because your muscles in your buttocks can get tight. But if it does occur, I would just reference that back more towards the oncology team.
Okay.
As far as the shingles, definitely that buttock pain, I could see coming more from, like how you're sitting and positioning. But as far as shingles flaring from it, I don't think that's usually doesn't come from positioning.
Okay, because they said from my first chemo appointment, I got the shingles immediately, like right away, like the next day, and I got blisters. I had 103 temperature, and
Okay.
so the PT said maybe it was the way I was positioned during chemo, but it was after the first chemo appointment that I got the shingles immediately, and it was like the worst pain ever.
I can't, yeah.
And so now it just clears up, Karyn, on occasion, like when I get stressed out, like this past week, I've had a lot of left breast pain. And so suddenly it started to flare up, but not full blown.
Okay.
It's just like, it's red, it's a little blister, and it's painful.
Yeah, I would definitely try to reference that back to the oncology team though.
Okay.
Because I feel like anything positional, obviously, or even, even the left-sided chest pain, if you're sitting in a certain, like some of that as far as soft tissue, or even if you were getting like numbness in your fingers, that I would say could definitely be like a positioning from how you're positioned.
Yeah, I mean,
so during chemo.
Yeah, I have neuropathy in both of my toes on both feet.
Okay.
That's graduated to the mid and now to the sole. So like my whole foot and my feet get so cold in the summer. I have to put them underneath hot water in the bathtub.
Okay. Okay. So yeah, I mean, and again, like anything you can do, keep the feet moving, keep the feet stretching, massage your feet. If you are, the only thing, warm water, but I'd caution against like hot water.
I know.
Because if you have that, the lack of sensation in there, I'd be super cautious of just going too overzealous with like the hot water. Yeah.
Okay. Yeah. Well, thank you, Karyn.
But I would definitely reference that back to the oncology team, especially since you're seeing a pattern of, chemo, minor flare.
And then my feet are freezing, and then they're freezing, and my
the
back.
shingles question though, I would reference it definitely back to the oncology team though.
Okay, thank you, Karyn.
You're welcome.
I don't have any more questions in the chat. So I am actually going to stop the recording. Thank you so much, Karyn.